So a colon and rectal surgeon is actually two surgeons. It's a surgeon that works with all the conditions of the colon. That is anything from your appendix all the way out to your rear end or your anus. And then a rectal surgeon does not just rectal cancer surgery, but also the anal conditions, the anal rectal conditions like hemorrhoids and fissures and fistulas. And so you have a surgeon who can do big abdominal cases, but then also small cases. In addition, usually colorectal surgeons, including me, perform colonoscopies. Problems of the colon where they can have colon cancers. Diverticulitis is a common one as well. There's of course rectal cancer, which is a very specific one and hard to treat. And then you have the cases that are seen most often, hemorrhoids. I see a lot of hemorrhoid cases, a lot of patients with just anal pain, constipation, as that's kind of up my alley as well, and then other things that are just wrong with their butt. Patients who have diverticulosis, which is just chronic diverticulitis or have had problems with that, if they've had severe diverticulitis, which is just inflammation of the colon, those patients could get elective surgery. If they have large polyps that can't be removed by their GI colleagues, then those can get elective surgery as well. And then many of the anal rectal conditions that I treat are usually done in an elective setting, as long as the patient is comfortable, they're not having too much pain, or if they're not having a big problem that needs to be addressed urgently. So here at St. Elizabeth, I work with many other doctors and many other surgeons to help treat the patient's conditions. If the patient has cancer, I will have to attempt to work with the oncologists who are there to provide chemotherapy and treatments for them. There's also radiation oncologists I work with as well. If they don't have cancer and they just have other conditions like diverticulitis, I might be working with a urologist to help with some of the problems that come with diverticulitis. And if the patients have certain conditions like inflammatory bowel disease, I work very closely with our gastroenterologists, both to identify conditions and treat them and follow them afterwards. One that's very helpful and very important in my field is actually the use of the robot. And here at St. Elizabeth's, they actually have the newest robot, and we have access to the robot in all the hospitals. I just use it as a tool, but it's a tool that helps me get patients feeling better, recover faster, and as a surgeon, it does make my surgery a lot simpler with the use of the robot. So for my patients, I think surgery provides the ultimate tool to get rid of their problem. There's a lot of conditions that we treat with medicines, but unfortunately there's a lot of things that are not treated with medicine. And so by using surgery, whether it's surgery and removing an organ or surgery and changing something about what the patient's problem is the ultimate way to fix it. We have a whole protocol in place in terms of how to guide them from before the surgery to after the surgery and in between. Usually our patients will actually meet us in the office staff about a week before the surgery, and we will go over all the information they need to know prior to surgery. This includes what medications they need to take, what they're going to do in the hospital, how active do they need to be, and what kind of recovery they'll have even afterwards. It really depends on the patient. It depends on what's going on with them and what's the best thing for them. And so for each patient, it's truly their decision and what's going on with them to determine if surgery is the right thing for them or not. And sometimes surgery doesn't happen immediately. Like I said, it's a discussion, they can think about it, and if things change in the future, at least they know what to do next. So if a patient's interested in seeing me as a surgeon to help their conditions, all they need to do is call our office number, and our office team is very helpful at guiding them to the right kind of person and right kind of location.